You are listening to OBP. Hello, everybody. This is Stephen Pohl, host of the Ohio Business Podcast. I'm joined today with Pranav of the SOAR Initiative. You are listening to the Ohio Business Podcast, where we sit down and chat with today and tomorrow's business leaders of Ohio. First off, thanks for coming on.
Yeah, thanks so much for having me.
How about you give a little bit of a backstory on yourself before we get into the SOAR Initiative?
Sure. So I'm currently a third-year undergraduate student at Ohio State. I study geography and public health. I'm originally from Boardman, Ohio, which is a suburb of Youngstown. So being from Ohio, being from the state with the second highest overdose death rate, pretty familiar in the community with the opioid crisis. And then coming to Ohio State, I had the opportunity to meet other people, other students who were interested in the crisis, either for personal or professional reasons. And we're all part of a service cohort. So our freshman year, we really started digging into issues that our local community was facing. And we found that the opioid crisis just affects so many different people. And we saw an opportunity to fill a gap that hadn't been filled by our existing structures. So that's how this project really came to be.
So the third year at OSU, correct?
Yep.
It's very impressive. So you're 21, 22?
20.
20. There you go. That's very impressive. And trying to change the world. That's amazing. And talk about what the SOAR Initiative is and where you guys are headed.
Yeah. So the SOAR Initiative, we're a 501c3 nonprofit. SOAR stands for Supporting Ohioans Throughout Addiction and Recovery. And we're really in the harm reduction space. So harm reduction in addiction is really the philosophy that we meet people where they are, and we try to keep people alive while they go on their journey, each individual journey to recovery. So our role we see as really empowering people with the tools they need to stay healthy and stay safe. So a couple ways we're doing that is by providing fentanyl test strips, which are a tool that people can use to test their drugs for the presence of fentanyl, which is a deadly drug that's fueling the majority of overdose deaths that can be found in heroin, cocaine, meth, ecstasy, a whole bunch of different drugs. So by providing these tools to people, we're really letting them have the knowledge of what they're putting in their bodies. And then our most recent project is the Deadly Bachelor app, which is an app that allows people to subscribe to receive alerts from Columbus Public Health, who have been really excellent partners that we've been working with for the past few months. And people can also submit their own alerts so that we kind of have this community-wide feedback system going where people can communicate with each other and empower each other.
That's important because a lot of people they dabble in that type of thing recreationally, or they're addicted, and then most people just don't think to use that type of strip. I've been affected by this through friends and their families, and they were laced and they died. It's horrible. What is the current state of testing with the strips, and then what are you kind of changing about that?
Yeah, so currently the fentanyl test strips are really a novel invention. So they were created by a company called BTNX. They're actually adapted from urine drug tests. So they're brand new. There's really only one research study done on them by Johns Hopkins. They only started getting into public use a couple years ago. They're still not really readily available. Government agencies typically are sort of hesitant, as with a lot of different harm reduction supplies, to provide this type of material because a lot of people see it as enabling drug use. But what we see it as is giving people the tools they need to stay safe. So this is one of the gaps that we saw where it's so stigmatized that people can't really talk about it. And we know that addiction is really a disease. It's a disease of despair. And it's not going to be just solved by telling people to just quit or seek treatment immediately. We need people to follow their own journey and give them whatever they need, meet them where they are. So that's where we see fentanyl test strips playing a big role, is with how dangerous the supply of drugs are in the streets. And they're getting more dangerous every year with carfentanil, which is an even more potent form of fentanyl, making a comeback in Ohio. We really see fentanyl test strips as an important part of harm reduction going forward.
Mm-hmm. It blows my mind that it's not viewed as a way to help people. I mean, like you said, you need to meet them halfway and meet them where they're at. And that's great that you guys are trying to change that. But so the mobile batch app, is that kind of like a more easily accessible way, kind of like a test strip, just to be alerted to be careful of where you're buying in that area?
Yeah, exactly. Yeah. So working with Columbus Public Health and the coroner, so they receive data on which neighborhoods are seeing overdose spikes, where there could be potentially deadly batches of whatever drug it is. So this is sort of a way to get this out to the community. A lot of the people that we're trying to reach either don't have good mobile service, a lot of them don't have internet access, or they're people like students who don't really think that they could be affected by overdoses. So this is a way to, one, sort of normalize testing drugs and make the community aware that any drug that you take could potentially be laced with fentanyl, as well as give people further access, as well as allow people to submit their own alerts so that we have government agencies and public health officials who are hearing from the community in a way that doesn't really it isn't really a threat to the community itself, because our app is totally anonymous, it's encrypted, and a lot of people who use drugs are really skeptical of authority figures, of law enforcement, since they've been traumatized by these people for so long. So this is sort of a way for them to communicate with public health agencies and receive the resources they need without feeling that they have to go out of their way to release private information.
You guys are just another great example of a tech-enabled solution to kind of bypass that, where they don't allow, the fentanyl strips to be given out or what have you, and you bypass that and you make it into a community-based awareness program. That's absolutely amazing. And you have a geographical background. That's what you're studying right now.
Yeah, geography and public health. Yeah,
mm-hmm. And that's GIS systems, right?
Yep, that's correct.
Yeah, I used a little bit of GIS systems back. I worked at like a real estate intern.
Oh, awesome.
But yeah,
yeah, it's so versatile. Yeah.
Yeah, it's awesome to see it being used in this type of situation for sure. So how big is your team right now?
So currently we're a group of 10 OSU students. So right now our alert system really just serves Franklin County and Columbus, but we are looking to expand in the future. So we're definitely looking to other cities in Ohio and even potentially across the nation to recruit in the near future.
What does your track look like in the future? Are you looking to do post-education or continue this full-time, or what do you think it's gonna look like?
So going into college, I sort of expected to go to grad school, and especially being involved in public health. I'm especially interested in the addiction industry after getting involved in this work and seeing the impact that it can have on the community. So that's where I thought I was headed, but seeing what we've been able to do with the SOAR Initiative, I don't know, it's kind of made me rethink where I head in the future personally. So I think I'd definitely like to see what goes on in the next 2 years, seeing the state of the overdose epidemic. And I'd really just, especially this early in my career, see where I can do the most good.
Mm-hmm. So you said that the fentanyl is making another comeback in Ohio. Is that correct?
Yeah, so this year actually we're on track to see the greatest number of overdose deaths in many years. So Ohio in the past couple of years has been trending down in terms of overdose deaths, but Franklin County especially, the last year we have data is 2018, it actually went up. And this year it's just incredible with the COVID pandemic, with all the isolation, the turmoil, people losing their jobs, not having access to housing and food. We're really seeing a spike in overdose deaths. So it's really alarming.
Wow. So it's such a shame. And I feel like it's kind of overlooked with the whole COVID epidemic, but people need to, it's just awful that this is a byproduct of what COVID has done with lockups and what have you. But do you see any of this type of application or just some other, organizations trying to do the same thing that you're doing?
Yeah, so we were actually inspired by a couple different organizations who are doing especially similar work to the app. One's in Vancouver, one's in Baltimore. So they both saw success. Vancouver especially is a really good example of progressive policy, technology, and community all working together to really make a dent in the overdose crisis. So we've learned a lot from them. We work with another organization called Brave, who are based out of Vancouver, who are making another app to allow people to reach out to other people while they're using, so that other people know that that they'll be safe. It's sort of like a virtual safe consumption site. So we do see other community organizations who are doing really great work that can both supplement the technology that's already there, as well as fill other existing gaps.
So that app is basically, if somebody's using, you can have like a direct communication line with them.
Yeah, exactly. So Brave's app is called besafe, and they're doing pilot testing in Columbus right now. But that allows people who are using drugs to call someone else anonymously, who will stay on the line with them and can sort of reassure them through the process. And if something were to go wrong, then they could get them the help they need.
Mm-hmm. So as the head of SOAR, where are you kind of spending the most time right now?
So right now, we're getting ready for the launch of our full app, which in addition to the alert system will also let people access different harm reduction and treatment resources, give people information about the different options for treatment that they have, places to get Narcan and other resources. So right now we're doing a lot of outreach to local community organizations, meeting with a lot of different people who we can potentially partner with to get the word out, to build trust within the community. So right now it's a lot of outreach, seeing where we can expand in the future, sort of evaluating how our programs are going right now.
What's that outreach look like? Are you going to like community centers, talking to local officials?
Yeah, so with the COVID pandemic, a lot of it has been virtual,
Mm-hmm.
virtual focus groups, things like that. Social media has also been great in getting to connect with people.
Mm-hmm. Now, where do you kind of see taking, what's the next step after fentanyl strips? How do you kind of bring more awareness to this fact, just this addiction and this crisis?
Yeah, so I think in terms of like looking at the bigger picture of the overdose crisis, I think honestly there's really only so much that nonprofits and people, outreach workers on the ground can do. I think this is such a systemic issue that has been, the overdose crisis was really created by unchecked corporations who were flooding the streets with prescription drugs. And I think we can provide access to harm reduction resources, and there are other organizations doing great work, letting people or giving people pathways to treatment. But I think at some point, we do need to see our government leaders step up. There needs to be real policy changes. We need to hold people accountable. Things like making Narcan easier to access.
Mm-hmm.
Narcan is a life-saving drug that there's really no downside to using Narcan. It's not addictive, and there's just so many barriers that people face to get it, and there's still so much stigma around talking about addiction, around talking about harm reduction. So I think there really needs to be more systemic change, and we need to see really governments and public health leaders being more proactive, meeting people where they are, really listening to the community and their needs, and really more of a focus on getting people the help they need, whether it's safe and stable housing, whether it's access to food. Addiction is really a disease of despair. So I think research has shown that once we get people the basic human rights that they need, it'll be a lot easier for them to be successful in treatment programs.
Why do you think officials and corporations have been just not proactive in trying to solve this crisis? Because it's pretty much a well-known topic amongst, in households. Why do you think that they just haven't been doing as much as they should be?
I think a lot of it has to do with stigma. I think just in general in society, we're sort of brought up to think that people who use drugs are sort of the other.
Mm-hmm.
And I think a lot of people don't really realize that addiction can really happen to anyone. A lot of people think it's just like it's just something that like people who are homeless on the streets, use heroin, they're junkies, whatever. But I think in society, we really need to start showing more compassion to really everyone around us, realize that it is a disease that can affect everyone. And I think once we get past that point, there will be enough political pressure on officials to really start seeing these people as people and do something to help them.
The worst part about the stigma thing is that you said they see a homeless person as the typical junkie, but that homeless person, and what I've basically gathered learning about this subject is that usually those are obviously it's a friend and family member, and then they had some type of accident, they were injured, and then they're overprescribed these opioids, and then they just got addicted to it, and then it was just a downward trajectory from there. And that's in most cases where I've experienced with somebody that uses, that's usually that path. They didn't even want to go down that path. It was just they were injured, they were supplied these drugs, and then they're so addictive that they just led into that towards that path, I guess. But that stigma is just definitely just critical, and these corporations facilitated it. The government allowed the regulation to basically once again facilitate it, but it's a shame that they aren't doing more to proactively change the situation. And people like you guys are definitely changing and leading that charge, which is just so needed right now.
Yeah, thank you. Yeah, you're absolutely right. I think the statistic is around 80% of people who are addicted to heroin or fentanyl now started with prescription opioids. And I think that's really where we really do need to hold these corporations accountable. And we can't have unchecked corporate power, like just discarding human lives. And there's so many just structural barriers along the way. Like someone, if someone can't afford their prescription opioids anymore, they turn to the streets. Then they become homeless. Then they lose their job. Then a lot of times they lose their health insurance. A lot of people who are homeless aren't even able to get IDs. So even just to apply for a job, there's just so many barriers along the way that I think we really need to see more people in power stepping up and making sure these needs are addressed.
Mm-hmm. And how are you guys are you guys raising money or through fundraisers? What's that kind of look like right now? Is it through the school?
Yeah, so some of our funding comes from fundraisers. We have really great community donors. We also have a really great partnership with Columbus Public Health. So we have a contract with them that lasts through August 2021, in which we sort of provide them the data on what batch alerts that people submit. So this is completely anonymized. We don't give any personal information, but this allows public health agencies to be more aware of where exactly the deadly batches are, where people need the most help, which can help them get the resources to the places they need.
Mm-hmm. And what does your data collection look like? Are you getting it through the public health services?
So we have our own backend set up through the app, where all the data comes through us first. It's all encrypted before it's sent to anyone else. We know that especially with this population, this is super important just because of the skepticism that people have around law enforcement. So we're really careful to protect people's data. So yeah, everything goes through our servers first.
Mm-hmm. And so, I mean, you're a third year student. What does your average week look like balancing all this?
Yeah. So it's pretty busy, but
Yeah.
I think one thing that's helped is a lot of time, or everyone that we work with, everyone that I work with in the SOAR Initiative are really my friends.
Mm-hmm.
So a lot of times, like volunteering at community organizations with other people that I know and enjoy talking to, strategizing, talking about different ways to do outreach, different ways to expand. It's really, it doesn't really feel like work because this is all work that we're passionate about, all people that I spend my free time with. So I think that's really helped make this feel like less of a time commitment. But in terms of how much time I spent working with the organization, I would say probably about 5 hours a week, um, sending a lot of emails, meetings. There's other people who are spending a lot of time like coding the app itself. We have really great programmers, super impressive that they're able to do this as college students.
Mm-hmm.
Other people are really great at reaching out to people. So I think the reason our team works so well is, one, because we're all friends and we all know each other, and two, because everyone is just so good at their individual thing that they do.
Mm-hmm. Oh, OSU gets some good people, huh?
Absolutely, yeah.
Yeah.
The benefits of being a top institution.
Yeah. I love how you guys are focusing on the Columbus area, but do you see this becoming a more broadly used application, throughout the nation?
That's what we hope. Yeah. It's sort of a patchwork of different policy approaches to the opioid crisis around the nation. And one thing we found is that it's really critical to get the trust of the local community and build relationships with people in the local community in order to be successful in something like this that relies so heavily on community. So we're definitely looking to build those relationships even now with people who are doing the work on the ground to distribute Narcan, distribute fentanyl test strips to the people that need them in other cities. So we're reaching out to people in Cleveland, people in Dayton, other cities that are heavily hit by the opioid crisis. But we definitely see this as a model that's scalable and that we think will be beneficial in really every city across the nation.
Now, can you order fentanyl strips just through like a website or anything right now, or how does somebody obtain test strips right now?
Yeah, so nonprofits are able to order fentanyl test strips in bulk from the distributor. Individuals can also order them. It's sometimes a little more difficult. There's some harm reduction organizations like Harm Reduction Ohio that give them out. There are other people just giving them out on the streets, like literally people who are just driving down the neighborhoods hardest hit by the opioid crisis and just giving them out. So it's really definitely reliant on community and connections.
Yeah, what I'm getting at right now is basically kind of like condoms and sexual transmission diseases, and so stigmatized through the education system, and I guess like it was abstinence or whatever, and then now you can get condoms anywhere you can. People give them away. That probably is what you guys' end goal is.
Absolutely, yeah, that's a great connection. Yeah.
Yeah. Where do you see this? You're kind of, I guess, your industry headed. Like, what are your hurdles right now? Your biggest hurdles in place right now?
So I think once again, it's probably the stigma and the political landscape in the country. We're really seeing, and I think the COVID pandemic has really brought it out, that there's just such a great divide between what politicians are doing and what people really need. Mm-hmm. Like, I know people talk about this a lot, but it's really ridiculous that the only really help that politicians have given individuals is the $1,200 check.
Yeah.
So I think that's a huge barrier, is really putting the pressure on governments to help out. But I think the state, but I do think there has been some progress in addressing stigma. I think that's one place where local public health agencies have been doing a lot of good work with education and awareness campaigns. So I think that's definitely going to be the key to unlocking all these policy, all the good policy that we need in the future. And I think it's interesting because, like, in terms of like the addiction industry, like that's sort of corporatizing like medicine is really what got us here in the first place. So it's sort of, I see the solution as not exactly like profit focused, but I think a lot of it has to be like nonprofits and other businesses working with governments and communities to work together to find solutions that work for the people who are really suffering.
I mean, that's such a big problem because this was created through profit systems, and then the only basic solution can't be really a profit organization, which is just a big hurdle that I think Americans just face in general with a lot of problems. And you
Yeah,
kind of
totally agree.
you talked about that divide where individuals and politicians is just there's no understanding. And I feel like we're just seeing that with the protests right now, and
Yeah,
it's centralized towards police brutality and Black Lives Matter. But I feel like it's just an overall overwhelming, like, this is the current system is just not in place where it's advantageous for the individual. They just don't understand. It's a great point you
absolutely.
make.
Yeah, yeah. So many people face so many hurdles, and we really see so many failures of our system. And I think COVID really brought that out.
Mm-hmm. As we kind of wrap up, what advice do you give to somebody, or what advice would you give to your previous self before you got into the SOAR initiative? What do you wish you kind of knew before you started this?
So I think one of the biggest things I've learned is really to really listen to people who are marginalized and whose voices are not typically heard. I think when we started out, we all sort of recognized the severity of the crisis, but some of the solutions that we were thinking of looking back were just totally ridiculous and wouldn't have worked for a variety of reasons. And I think that's one thing that especially people who are young and ambitious, speak like I'm not 20 years old and still young and ambitious, but but I think people who are really seeking to do good, one thing that is really easy to fall victim to is sort of you put yourself on a pedestal that you really don't belong to yet, and that's definitely criticism of myself as well.
Mm-hmm.
I think you really have to humble yourself and realize that in order to really do good and help the people who have not been helped by others, you do have to listen to them, be willing to learn things, be willing to really change the way you see the world, and sort of think outside of sort of what you were taught. And especially if you grew up in a privileged suburban community, or you're not a member of a marginalized community that you're trying to help, really have to center those voices. Yeah.
Well, and then what would you say some successes and some failures leading this charge?
So I think our biggest success has really been, I think, how much buy-in we've gotten from the community of people who use drugs. We've really heard that people have benefited from the Deadly Batch Alert system, as well as making fentanyl test strips easier to access. So it's been really heartwarming for us to hear that we've made a difference. I honestly didn't really expect to get this far in this short of a time period. We've gotten over 200 users. So more than anything else, it's just nice to hear that we made a difference. In terms of failures, I think, like I was saying before, there's, I think this happens in all businesses. It just the continuous repetition of you come up with a bad idea, you go down this path where you start to implement it, and then you realize it's a bad idea, and you sort of have to change your way of thinking. So I think that's been definitely one thing that we've learned, is that you definitely have to put away your ego and hubris and be willing to admit that certain ideas are just bad and are sometimes going to even cause more harm. Even if it looks like it's a shiny, innovative idea, sometimes even the most complex and interesting ideas may not actually be willing to work.
I mean, that's the best part about kind of starting something like what you have. The more you make those mistakes, as you go on, you can realize them faster and then move on, and then you can learn from those mistakes, see what worked, what didn't, and then kind of implement them into your current system. So it's just like a compound effect,
Absolutely, yeah.
Do you see? Could you guys partner with like OSU to get this application to students? Because I feel like probably that's where the biggest drug use is during the college years.
Yeah, totally. Yeah. So we actually have an associated student org on campus called Buckeyes for Harm Reduction. So through that student organization, we've been making some connection with students and professors, different agencies on campus. One big thing that we're looking to push in the near future is definitely doing more awareness through Greek life. We see that as somewhere where we really need awareness.
Mhm.
So yeah, it's kind of difficult with an institution as large as OSU, and to be frank, OSU definitely needs to do better with its approach to harm reduction. We've tried reaching out to certain people. It's definitely a barrier in terms of breaking through the image problem with you have this institution like OSU, which is sort of seen as someone who's like leading the charge, implementing all these innovative things, but also you're worried about like political pressures, you're worried about how the community perceives an institution like this. So especially with an issue as contentious as drug use, with a lot of strong opinions on a lot of different sides, it's sort of difficult breaking through all that bureaucratic red tape. So we're definitely continuing to push OSU. There's other great organizations that are doing the same. So definitely hope to see some progress there in the future.
Last question. Any words of wisdom to any type of entrepreneur out there or college student that is looking to get into entrepreneurship?
Yeah, once again, I'd say definitely if, I really believe that everyone who is setting out to do good really like in their heart does want to help people. But I think that unfortunately, I think a lot of what people end up doing sort of reinforces the systems of oppression that people face. And I think it's really important that before you roll out your big idea, you really have to talk to the people who are most marginalized, find those different perspectives that aren't typically heard, and really learn about the specific community that you're trying to serve. And I think there's definitely places for business and nonprofit in a variety of different spaces to do that. But I think it's important to recognize the bigger societal picture.
How can people find you and the SOAR Initiative?
So we're available on Facebook, Twitter, Instagram, LinkedIn, at the SOAR Initiative. I'm also on Twitter. It's probably where I'm most active, as well as Instagram. We also have a website, thesoorinitiative.org, so you can learn more about our projects, as well as find links to donate to our cause. So yeah, please check that out if you're interested.
Pranav of the SOAR Initiative, you're doing great work. Thanks for coming on.
Yeah, thank you so much. Thanks for having us.
I want to introduce you guys to the Ohio Business Podcast first sponsor, Nextdoor. Want to earn extra cash with your extra space? There's an app for that, to Nextdoor, the marketplace for your storage space. Nextdoor is currently taking on new hosts like me. Simply visit their site, nextdoor.com, nxtstor.com, to get the app. Just think what an extra $200 a month can mean to you by simply storing your friends' boxes and mattresses. Once again, check out nextdoor.com. Thanks. The Ohio Business Podcast is sponsored by Jansen Media. Jansen Media is a website design and digital marketing agency. They develop custom strategies and solutions around client goals and business objectives. From day one, they have been focused on results, building websites that deliver more online traffic, more conversions, better user experience, easy navigation, and web functionality. You can find Jansen Media on their website at jansenmedia.com. That's spelled JANSCEN media.com. That's jansenmedia.com. Thanks.